Hello, future doctors. Today, we're diving into a topic that's literally mind-blowing, neurocysticercosis. Or as I like to call it, that time a tapeworm decided your brain was a luxury Airbnb. Grab your notes. NCC is the most common parasitic infection of the central nervous system worldwide, caused by Taenia solium. The life cycle is a bit of a toxic relationship between humans as the definitive host and pigs as the intermediate host. We get it from eating undercooked pork containing larvae or by ingesting eggs from contaminated food or water. Once those eggs hatch in the gut, the oncospheres travel through the blood and settle in the brain. Cozy, right? Starting with clinical features, look for parasite excretion in stool and those palpable, painless skin nodules. Patients might present with systemic symptoms like fever, weakness, and muscle pain. It's not just a headache, but the big ones, seizures, meningoencephalitis, and even personality changes. The brain is literally reacting to the guest. Watch out for hydrocephalus and an unstable gait. NCC is a master of mimicry in clinical neurology. Because it can look like so many other things, our investigations need to be spot on. Let's look at the lab work. Step 1. Check the stool for ova and cysts. It's old school but effective for finding the source. On X-ray, look for classic cigar or rice grain calcifications in the muscles. That's a huge clue. CT scans are our best friend here. We're looking for multiple, small, ring or disc-like enhancing lesions. And on MRI, the famous starry sky appearance, though it's much less romantic than it sounds. Now, how do we get rid of these uninvited guests? The treatment is a bit of a multi-step process. For simple intestinal infection, albendazole 400 mg for 3 days is usually the first line of defense. Praziquantel and niclosamide are also options, but NCC specifically requires a bit more firepower. For brain involvement, we step up to albendazole at 15 mg per kg daily for 2 to 4 weeks. Critical point. Always start steroids like prednisolone at least 1 day before the antihelminthics. Why? Because killing the larvae causes inflammation. We don't want the brain swelling up during treatment. The regimen changes based on cyst count. For less than 2, it's A plus S. For more than 2, we add praziquantel. Don't forget antiepileptics for seizures. And if the lesion is already calcified, no antiparasitics needed. And there you have it, the essentials of neurocysticercosis. Review these notes and you'll crush your exams. Thanks for watching. Stay curious, stay sharp, and I'll see you in the next lecture. Bye.